Their contributions have provided Indiana, in fact the country, with extremely valuable new information.
A study that is believed to be the first of its kind, new coronavirus numbers for Hoosiers that people around the nation are studying with great interest. Good evening, everyone. I'm Brooke Martin.
And I'm Phil Sanchez. For the first time, we're getting a look at how many Hoosiers have COVID-19. Wish TV's Dan Klein joining us now live from the State House. And Dan, officials believe this is the first randomized study in America to determine just how many people have or had the virus.
And it's a lot more than testing has been able to capture. In fact, more than 11 times more. Scientists believe that 186,000 Hoosiers have or had the virus, and that was more than 2 weeks ago.
We gained significant new knowledge.
Knowledge that the rate of Hoosiers infected with the coronavirus is just the tip of the iceberg. In late April, when there were just 17,000 positive tests, new data suggests 186,000 Hoosiers were infected, nearly 3% of everyone who lives in Indiana.
The good news is that by slowing the spread of the virus, we now have bought some time to determine the best way forward.
The study also, for the first time, puts a number on the true fatality rate for the coronavirus. Not just those who were tested, who tend to be sicker already, but everyone who has gotten it. It is 0.58%. Basically, for every 173 cases, one person will die. 172 will not.
Which is a lot less worrisome than the numbers we had before, but is not a necessarily we're scot-free number. This, for example, is significantly deadlier, almost 6 times deadlier than seasonal flu.
The state-sponsored study conducted by IUPUI Fairbanks School of Public Health randomly tested 4,600 people around the state almost 3 weeks ago. It found 1.7% of people were infected at that time. Another 1.1% tested positive for antibodies, meaning they'd recovered, for a total of 2.8% of the population. In other words, 97.2% of Hoosiers have not been infected.
When we see that the vast majority of people in Indiana have not experienced this disease, and again, without a vaccine, it tells me that we have to continue to be extremely vigilant.
Particularly when you add in this number. Almost 45% of positive tests say they never developed any symptoms. And one more important number, 12. A positive result in the study was 12 times more likely if they lived in a home where someone else had already tested positive.
Strongly suggests that our social distancing policies played a critical role in curbing the spread of the virus and containing it to within households as opposed to within the community.
And state officials say that's their biggest takeaway too. So don't expect any major changes in the governor's rollback as a result.
It really underscored the fact that our social distancing measures were really working.
In it for the long haul. We were hunkered down. It paid off.
Dr. Christina Box says she hopes this study sends a message to businesses about the safety measures that they should be putting into place as they reopen. Meanwhile, a second wave of testing is scheduled for the first week in June, which will measure how the relaxing of these guidelines and how that affects these numbers. Reporting live from the State House, Dan Klein, Wish TV, wishtv.com, and be sure to follow us on Facebook.